This video will cover the basics of 10-0 nylon suture practice you can use in the wet lab. In order to do this, you'll need 10-0 nylon suture packet as shown, and you'll need needle drivers, ideally delicate non-locking needle drivers. You'll also need delicate scissors, like those Van Ness scissors, and forceps, such as a .12 with tying platform and this McPherson. This suture packet has two needles. In order to use one half at a time, locate the loop and cut. In order to begin, you need to remove one of the needles from the foam packet. Leave the other one in place as you'll save it for later. As you remove the needle from the foam, be careful not to use excess force and pulling if you feel a lot of resistance. The needle will detach from the thread quite easily if you're not careful. In order to load the needle driver, grasp the suture thread with your forceps and grab about 3/4 to 4/5 of the way up the arc towards the thread with your needle driver. You can use your forceps to move the needle delicately as shown, avoid touching the tip. That works for a forehand pass. In order to do a backhand pass, grab that thread again and you can spin the needle on its arc and grasp with the needle tip facing away from you. Now you're ready for a backhand pass. Practice closing corneal wounds. You want your suture to be symmetric, and the central and peripheral length should be identical. Start with a 3-1-1 interrupted suture. This is a great knot to begin with. As you approach the wound, you want to enter the tissue with your needle tip oriented rather vertically. You'll quickly use your wrist to rotate that needle through the tissue. This is not a pushing maneuver. If you push, you will bend this delicate needle. So you can see here as a rotation of that needle tip through the tissue, and you want to be symmetric with the same length centrally and peripherally so that you have a symmetric suture. The suture is radial. You do not want an oblique suture. I'm using my second instrument to guide the loose suture, so I'm careful not to pull it through. I'm making 3 rotations here, so 3 rotations around that tip. Keep some tension here so the loops don't fall off. And you want to bring this down flat. You can see the suture wound around itself there. That's what you mean by laying the knot flat. You're going to make 2 additional loops. There's the first one. And you want to make these loop throws relatively, with the needle driver positioned relatively on top of the suture, so you don't have to move very far. Once you have your 3-1-1 knot completed, you want to make sure there's no air in that knot so it's nice and compact. You'll use your scissors to cut those tails. Now you want to cut them short enough so they're not a problem, but if you cut them too short, it can undo the knot, so use care. And then we'll use our tying forceps to bury that knot. Any knot on the human eye should always be buried if it's on the cornea, so make sure that knot is buried as shown. 2-1-1 interrupted suture is very similar to 3-1-1. The difference is the 2-1-1 knot is going to be more compact and easier to bury. Once again, you want to enter vertically with your needle, rotate through that tissue rather than pushing. The second instrument can be used to help that tip of the needle pop through the tissue as shown. You do want to use care when this maneuver and grabbing the needle to rotate it out. That you do not touch the tip, as the needle is delicate and will dull very easily. Use that second instrument there to guide the thread. And here I'm putting that needle down and off to my left. I want to try to avoid having excessive suture in my surgical field. You'll see here, there's not a lot of thread around where I am tying. There's that 2 loops down, and now I'm laying the knot flat, and then immediately I'm going to lock it by bringing those 2 instruments together, and that helps that knot hold tension. If you do not lock a 2-1-1, the knot will open and you'll lose your tension, and the suture tension will not be correct. So here's that third throw, the 2-1-1. And again, we'll use our scissors to cut these tails to be relatively short, leaving enough so we're not making sure not to cut the knot itself. and then we will bury the suture. Uh, Suturing requires a lot of practice, so please, 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 please make sure you use your time and training well and practice this in simulation context rather than on live patients. Thank you so much.